Hello everyone. In this lecture we're going to be talking a little bit more about qualitative research. Now the lecture is actually split up into three parts. In the first part we're going to discuss it more broadly and describe different types of qualitative research. In the second part we're going to talk about how one would design a qualitative research study. And in the third part we'll talk about how one would conduct a qualitative research study and actually analyze the data. Now let's take a second and remember what the difference is between qualitative and quantitative research methods. Well, an easy way of just remembering this, as we discussed previously, is qualitative research is really focusing in on words and people's descriptions of their experience in some form or another. Quantitative research really tries to attach numbers to some sort of health phenomenon or to measuring different people's experiences. So I'd like to start off by illustrating a little bit of why qualitative research is important. Now you're not going to like me for this, but let's do this little exercise. All right. So I'm going to ask you a question and ask you what best describes your opinion about this question. So first off, caring for patients is very rewarding, so my salary isn't particularly important. Is that your opinion? 2, do you have no opinion at all about this question? Or 3, caring for patients isn't particularly rewarding, so I should be paid better. So which of these is your preferred answer for this question? And you have to pick one of them. All right, so I'm fully aware that this was an annoying question to ask you, and I did that for a purpose. And the point is that something's wrong with this question. All right, so one of the issues with quantitative research is sometimes it makes presumptions based upon hypotheses about what the reality of someone's experience is. Now, in some cases, those assumptions are wrong. So if you look at this question here, a quantitative research question, if you had actually bothered to talk to any nurse about this question for even 10 seconds, they could have told you almost immediately, using their own words and their own experiences, why this is an idiotic question to ask. And that's really, I think, a really important illustration of why qualitative research is important. This is a situation where you provide an opportunity for people to speak for themselves and describe their experiences, especially when you don't have a lot of information with which to study a question. So this is really typically seen as being early stage research. So let's look at the relationship between qualitative and quantitative research a different way. So qualitative research is really an example of what's called inductive reasoning. And in this situation, you have some observation in the world, some overall question that you're looking at, and you observe it using interviews or by being in a certain context, cultural context, whatever. And you try and take the data that you collect to create some sort of pattern out of it. You then take that pattern or what you're seeing there and perhaps develop a tentative hypothesis as to what's going on. This may even take form in some sort of theory that someone could use to understand this phenomenon that you're trying to look at. Now, quantitative research is doing exactly the opposite. So instead of looking to understand a problem without having any initial biases or thoughts about what it is and to try and gather that information from people, quantitative research uses what's called deductive reasoning. And here you start off as a researcher with a theory about what the reality is of a situation. You then say, okay, if my theory says this, then I think that this is what's going to happen in this situation. And you create a hypothesis or prediction about what will occur. You then conduct observations where you collect data using, for example, a survey. And then you take that data and you analyze it to do statistical tests to either confirm or deny your initial hypothesis and prove or disprove that theory that you had made. Now, these are two different approaches, deductive and inductive reasoning, and both of them have virtues to them. And can accomplish different things. And we'll talk more about why quantitative research has certain advantages at a later point. But the point I want to make right here is that the two relate to one another. Qualitative research can be used to help generate theories, and quantitative research can be used to take that theory and actually show using data that it does work in practice and confirm that theory. And often by using this information, this quantitative information, you can say, okay, well, it looks like this is happening or that is happening, and maybe there are areas where we actually don't really know enough, or the data isn't supporting this theory. And then you can go back and do more qualitative data to get more information about how that is actually occurring. So it does work in a cycle where the two forms of reasoning can interact with each other, or at least ideally that's how it would work. So qualitative research really does seek to understand human phenomena as a whole thing, as a holistic process, where you actually understand people in their own settings and allow them to use their own interpretations of what their experience has been. It's also grounded somewhat in the belief that objective data cannot really accurately explain the full range of human experience. An example of this was the little survey that we had at the beginning of this lecture, where quantitative data really was trying to crunch down and create numbers around a question that really did not capture a whole range of a complex and rich question. And this is often a motivation for qualitative research to give life and meaning to people's actual experiences in a way that's understandable through this type of research. So why do qualitative research? Well, there's a few different reasons. One would be simply the nature of the problem that you're looking at. If you really want to have a deep understanding of how people experience something, you really have to use this method. Also, it's typically used, as I mentioned before, when we don't actually have a lot of data yet about the phenomena that you're interested in. It's very hard to design quantitative studies that have any meaning if you don't have any basic knowledge of how people are thinking about a question and what their experience has been. Some people do it because of their philosophy. So the related to the previous slide, the question being, truth is really connected to context, and that some people really feel a need to focus in on people's complex and rich experiences in their actual life. All right, so what are the different types of qualitative research that are out there? Well, one of them is the case study. Now, the case study is really seeking to understand a specific unusual situation or experience. It's typically conducted with an individual who has some unique experience, or with a small group of people who have gone through the same thing. So what might be some examples of this? Well, say you have a new medical technology that improves accessibility for the blind, or an example of a group situation might be you might want to study a nursing unit that has responded to the needs of flood victims after Hurricane Katrina. So these are distinct experiences that are somewhat unusual, and that by studying them, you can perhaps gain information that could be applicable in other situations. What I do want to note here is that case studies are often qualitative because they're looking typically at individuals or small groups. But sometimes quantitative data is also collected, and this is often used just to help describe the experience of the individual. Now, another approach is the ethnography. So an ethnography really focuses in on groups of peoples and specifically cultures. And it's really based out of the field of anthropology. Now, it can be done through doing interviews with individuals, but a very common approach for this is actually for researchers to become what are called participant observers. This is where they actually try and become part of that culture in some sense, and to learn from people in that culture, preferably without actually changing that culture itself. So what might be an example of this in nursing? So a question that might work here would be, so how do people who are in a 12-step weight loss program interact and support one another? So by getting this information, you can help support this culture and know how to actually create effective health interventions that really meets their specific needs. So grounded theory is another approach that's taken as well. So what is this trying to do? Well, it's really seeking to develop a theory where, in a situation and context where there was no very little information previously, and probably no theories about how something happened. So this is often done in a process where you're trying to understand how people respond or address a specific concern or problem. So how do people, if someone, well, let's see, what's an example? So how do the elderly develop attachments with their caregivers? So by developing a theory for how this attachment develops, you can actually help direct future interventions. If you were, say, to try and work with the elderly to support those attachments. And you can also take that theory and use it in future research to get more information about the needs of this specific population. Lastly, I want to mention phenomenology. And phenomenology is really seeking to understand, investigate people's experiences in a specific context. So, in particular, you're thinking about how do patients respond to the realities and circumstances of some illness, or how do people who are caregivers experience working with a patient who has this illness, for example. So the idea here is that by interviewing a number of people who have this experience and share this experience, you will come to understand the essence of what it means to be in that situation. So what are some examples of this? Okay, so what is it like to experience a medical error and to work with healthcare providers to address this concern? So that would be a question that is focusing in on somebody's experience. Another example might be, what is it like to experience loss of hearing while in the long-term care facility? Right. So by understanding this and understanding the experience of someone going through a specific health condition, you can better tailor your care to their specific needs. All right. So let's just do a quick exercise to illustrate these different approaches to qualitative research. All right. So if you had this question, what approach would you think you might take? So the question is, how do patients learn self-management through applying and adapting diabetes information to their lives? Well, this is really grounded theory. So it's trying to describe how people learn something. So this is describing some sort of theory about how people process health-related information to improve their lives. All right. What is the experience of hope for people who have cancer? Well, this is an example of a research question that would probably be best addressed by using phenomenological approaches. And the tip-off here is, when something uses the term experience, understanding someone's experience, that's very often a phenomenology that will be used in that context. All right. How do relationships between nurses change at the Evergreen Hospital ER as a mentoring program is introduced? Well, that's a case study. That's looking at a very specific situation where something has happened, and you're looking at a small group of people and trying to understand, well, what did happen as a result of doing this? And what is cultural about particular patterns, transitions, and trajectories of smoking? Well, this would be an ethnography. So, in this context, you might be working with a specific cultural group to understand how they're thinking about these specific patterns and how smoking is understood in their community. All right. So that's the end of part one. In part two, we're going to talk a little bit about how you design a qualitative research study.